The topic for today's training is about messaging strategies to improve COVID-19 confidence in agriculture worker communities. It's always very exciting to see so much interest in this topic. I know that you will find this information that we're going to present today extremely useful. So thanks again for joining us. I'm Yvette Salinas. I'm the manager of National Outreach Services here at the National Center for Farmworker Health. Our mission at NCFH is to improve the health of agriculture workers and their families. So we shared a link in the chat. Erin, you might have shared it earlier, but if you can share it now with a few brief questions about who you are and what organization you're with. NCFH loves to partner with new groups serving the agriculture worker community. So please take a moment to fill out those questions in case we need to reach out to you in the future. I understand that some of you may have registered today. So if you already filled them out, don't worry about filling it out now, but if you registered prior to today, please open up the link and then keep that tab open so that you can submit that to us before the end of the presentation. We plan on continuing to host more trainings in both Spanish and English for CHWs, promotores, promotoras, and other advocates who serve the agriculture workers throughout, who serve agriculture workers and their families throughout the next couple of months. So please be on the lookout for those invitations. We will be sending it out to all the participants today. Next slide, please. So the training will be in English with Spanish interpretation. Our interpreter, Zeke Quijano, will be helping us out. Esta capacitación será en inglés y va a ser interpretada en español. Si prefiere escuchar esta presentación en español, busque el botón que parece ser un mundo en la parte de abajo de su pantalla y dice interpretación y escoja español. Les daré un par de segundos para que hagan su selección de idioma. And I'll give you guys a few seconds to make your selection for your language preference. Okay, and I do remind everyone who's joining us to please mute yourselves. This is a webinar style. If you have any questions, please put your questions in the chat and our presenter will get to your questions throughout the presentation or after the presentation. So just a friendly reminder to mute yourselves. Okay, next slide. All right, so I'm honored to introduce our presenter for today's training. I've worked with her the last couple of weeks and she is a wealth of knowledge on the subject of vaccines. So if you attended our previous training on vaccine confidence last month, you may have had the opportunity to ask questions and share concerns throughout the breakout sessions, concerns that you may have heard in your work and in your community. So today we won't be having any breakout sessions. Like I said, this is a webinar. Our presenter today, Robin Correll, will address many of the concerns that were disclosed during that training. So Robin is a community health worker instructor and a public health professional based in Houston, Texas. For the past 10 years, she's been working in the field of vaccine education, helping healthcare providers, community health workers, and the general public better understand vaccine science and how to combat misinformation about vaccines. Today, she'll be talking about messaging strategies to strengthen vaccine confidence that everyone here can use with your patients and your clients in the agriculture worker community. So we have 90 minutes today, and I'll hand the mic over to Robin so that she can start us off with the learning objectives for today.
Thank you. And before I dive in, I do want to say just what an honor it is to be here today. I actually got my start working with promotores and community health workers about 11 years ago, working in rural Peru. I was living in Peru at the time, and we, with workers, we would go out to the chacras, the banana fields, and we would talk about health topics and things that were really important to the health workers at the time and into the communities at the time. And so I learned there just how incredible community health workers and promotores are, the passion that you all have for your community, the dedication that you have to helping people live healthier lives. I am just constantly in awe of the work that you do. So I'm super excited to be here today. And I'm excited to talk about a topic that is really very important to me, that I feel very passionately about. And hopefully you all will walk away with some tools that you can use to help the patients and the clients that you all work with every day. So as community health workers, you know how to connect people to care. You know how to build relationships. You have the trust of your community. So you already have a great foundation to build vaccine confidence in your communities. Today, though, we're just going to talk about some of those additional skills that you can use, some techniques that you can use. So after today's presentation, our hope is that you'll be better able to respond to questions or concerns about COVID-19 vaccines using research-aligned communication strategies. And the one that I will be talking about in depth today is actually called the CASE approach. So that's the one that we'll be going through. Hopefully you'll also be able to discuss how vaccines are studied and monitored for safety. That came up a lot in the last webinar and the last training that you all had together. That's a big question and concern that people have. So we're going to spend a little time talking about that. We also hope that you'll be able to explain not just the short-term side effects of these vaccines, but also what potential long-term side effects and what we know about what might happen after getting vaccinated with a COVID vaccine, and how these effects might be able to be managed. We're also going to be talking a little bit about some of the concerns and myths that we've heard, such as COVID vaccines and fertility. So at the end of this presentation, hopefully you'll be able to describe what is known about that. What does research show about it so far? We're also going to be talking about fetal cells, which is another concern that came up several times in the last training. And so we'll talk about, what really do we know about fetal cells and vaccines, and how does it affect COVID vaccination if it does at all. And then also, and this is really the crux of it, once we're able to build vaccine confidence, how can you best guide folks on where and how to get vaccinated against COVID-19, particularly if they don't have legal immigration status or documentation. So let's dive in. Anyone over, oh, and by the way, I'm going to go ahead and turn off my camera just so that you all can make sure that you see the slides, because I know sometimes the camera can block it. So now that you all know I'm not a bot, I am here. So anyone over the age of 16 can get a COVID vaccine for free in the United States. And that's anyone. You do not have to prove that you have legal immigration status or official documentation, and you should never have to pay anything to get a COVID vaccine. Some sites might ask for identification so they can have accurate health records, and they might ask for insurance so they can bill an insurance provider, but they should not turn away anyone if they don't have either of those documents. The White House has been very clear about this. Everyone here in the United States should be able to get a COVID vaccine if they want one. So why is it so important to establish and increase confidence in the COVID vaccines and get people vaccinated? To put simply, these vaccines will save lives. Things like masks, keeping our physical distance, washing our hands, improving ventilation, all of those precautions have been really, really important throughout this pandemic. They lower our risk of getting the virus. But as we've seen this past year, they sometimes aren't enough. Not everyone can take these precautions because of various reasons, or they might take the precautions, but they're not foolproof. They're not 100% effective. So they might still end up getting seriously sick with COVID. And that's really where vaccines are super important. COVID vaccines protect people from getting seriously sick or dying from COVID-19. And thankfully, we do have some options. As of today, May 5th, 2021, there are 3 vaccines available to protect against COVID-19. Each of them have their pros and cons. So for example, Pfizer and Moderna's vaccines, they need 2 doses, which can be tough for some people to swing. 2 doses, 21 to 28 days apart. You have to get in for the first dose, get in for the second dose. That can be a barrier for some people, but they are more widely available. We have more doses of those vaccines. They're available in more places. Johnson & Johnson's vaccine, for example, only has 1 dose, but it can be harder to find. And so there are some differences in some of these vaccines. There's some pros to some, cons to the others, and there's some slight differences in terms of safety, which we'll talk about in a bit. But you might notice I don't have effectiveness percentages on this slide. And the reason I don't get into that one number percentage is because it's very hard to compare the effectiveness of these vaccines right now. And the reason why is because they were all tested in clinical trials, but those clinical trials happened at different points in the pandemic, and there might have been different variants or different versions of the virus that were spreading depending on where these studies were conducted. So we haven't done a huge large-scale study to compare, to pit one vaccine against another. So I can't tell you which vaccine has, it has this particular number, which vaccine has that particular number. I personally don't think that that's actually the helpful thing to focus on. What I think is super important is that all 3 of these vaccines are extremely good at protecting people from being hospitalized or dying from COVID-19. And that's really the point that I think is very important to focus on as we're talking with people who are considering what vaccine to get or maybe weighing their options. Something for them all to know is that all 3 are very good at protecting against hospitalization and death. As more studies are done, we might get a better sense for how these vaccines compare. But I think it's just really important to bring it back to, we lost 500,000 people last year. And many more are living with the long-term consequences of this virus. So it's not about protecting people from sniffles. It's not about protecting people from coughs. It's really about protecting them from being hospitalized or dying from this virus. I do want to note, I did mention that all people are eligible to get the vaccine. There are some individuals who shouldn't get vaccinated yet, and I do want to just mention them very quickly. We don't yet have vaccines for kids under 16. We might very soon, but right now, as of today, only those 16 and up are eligible to get vaccinated. And then there are also those individuals who currently have COVID-19, who are actively infected with the virus. They should wait at least 10 days after their symptoms first appeared or after they tested positive if they don't have symptoms. They should wait until they've been fever-free for 24 hours without any medications, and they should wait until their other symptoms get better. Basically, waiting until that isolation period is over before they can go out to get the vaccine. But after that, there is no minimum amount of time that they have to wait unless they were given antibody therapy for their COVID. And then if someone has a risk of a severe allergy, just like some people are allergic to peanuts or penicillin, some individuals might be allergic to a component of a COVID vaccine or a component that's very similar to something that they're allergic to. So if they are at risk for a serious allergy, then they should talk to their doctor about which of the COVID vaccines they can safely get. But thankfully, we do have options. Like with anything, there can be side effects. So thankfully, when these side effects do happen, they're almost always mild, temporary, and manageable with over-the-counter pain relievers, which, as a side note, should only be given after you get vaccinated, not before. And we should follow the same guidelines. If you can safely receive pain relievers during normal times, then you should be able to receive pain relievers after vaccination. But it's always a good idea to talk to your doctor if you're not sure. And I know that can be a lot of stories shared on social media about people getting completely laid out after this vaccine. I think many of us have heard those horror stories of getting sick after the vaccine. And I do want to reassure you that this isn't a universal experience. Some people can feel pretty crummy for a few days. That's true. While others might feel completely fine. When I got vaccinated, I had a headache and a sore arm for about a day or two after each dose. But I took Tylenol and was able to take care of my kids and go about my day without much issue. And my husband had a slightly different experience. He got the same vaccine. He had fever and chills for a few hours, but then he recovered really quickly. So our experiences are actually pretty typical. If you look at the research, if you look at what happened during clinical trials, what happened to us is a pretty common response, but all of our bodies react slightly differently. What we experienced are actually the side effects that we experienced, like the sore arm, the headache, the fever. Those are actually a really good sign that our bodies were responding to the vaccine. Fever, for example, is a way that our body tries to cook out invaders. It turns up the temperature in hopes that the higher temperature will destroy whatever virus is trying to make us sick. And vaccines aren't dangerous like viruses are. They're not exactly the same thing, but our body reacts like they are. And those sometimes uncomfortable reactions that we have are actually the body doing its thing, learning how to protect itself. So when the vaccine went into my arm, my body immediately recognized that something wasn't right. It called up its immune system, the defenses in our body, and those cells rushed to the part of my arm where the vaccine went in. And that was why my arm felt hot and then later sore. It was my body doing its thing. So again, while these reactions can be a little uncomfortable, they can be disruptive for a few days, they are a good sign that the body is responding. And it should be noted that none of what I have up here compares to how truly dangerous COVID-19 can be. And that's a really important perspective to keep in mind as we're going through some of these concerns that we'll talk about today. So it takes about 2 weeks after your second dose, or if you get the Johnson & Johnson vaccine, your one dose, for your body to build up its response, build up its protection against the COVID virus. After that, your risk of getting seriously sick is a lot lower, so you can do some things more safely. For example, you can gather indoors with other fully vaccinated people. You don't have to mask or keep 6 feet apart if you're all vaccinated. You can go back to having those family dinners if everybody in your family is vaccinated. And you can also meet up with one other unvaccinated household. So that includes families who might have unvaccinated children. You can meet up with one other household without masks or keeping your distance if you're vaccinated. So that's a really great benefit of getting vaccinated and making sure you get those 2 doses. You can also gather outside without wearing a mask, except in cases where it's really crowded, like a festival, or here in Houston, we have a rodeo. So in those kinds of instances, you would still really want to mask up and wear your mask, just because you don't know who else in that crowd might be vaccinated or who might be carrying the virus. And yes, I've gotten a question in the box about whether I'll talk about the Johnson & Johnson's vaccine being unsafe. I will talk about that, so don't worry. Stay tuned. All right, you can also travel a little more safely and a little more freely. So in the US, the recommendation has been that if you travel, or if you need to travel, you should quarantine. So stay away from other people for a couple weeks and get tested. If you're vaccinated, you don't need to do that unless where the place you're flying to has requirements. But the recommendation for vaccinated people now is that if you're traveling within the US, you don't have to get tested beforehand and you don't have to quarantine before and after. You should still wear a mask while traveling, though. You should still wear a mask on the plane and in the airport, just because it is harder to keep your distance and it's not always clear who's been vaccinated and who hasn't been. And then if you travel internationally, you still might need to go through the testing process. You still might need to quarantine. You just need to look at wherever you're traveling to, what their requirements are. And perhaps most importantly, being vaccinated means it's a lot safer to be around somebody with COVID. You should still wear a mask if you're around somebody who has COVID-19, but you don't need to quarantine afterwards. So if you are working with patients who have COVID-19, you don't need to keep your distance from your kids, for example. That's not, the recommendation is that if you're vaccinated, that's no longer a precaution that's necessary or strongly advised. You can be more safely around other people after you've been vaccinated, because your risk of getting sick is so much lower. And as more people get vaccinated, everybody's risk will start to go down. And so when that happens, when the risk starts to go down, we'll start to be able to scale back some of these precautions and get back to some of those things that we really valued prior to the pandemic. Being together, gathering with loved ones, and the closer we get to having a lot of vaccinated people, the more likely those things will be. Traveling internationally with kids, I would need to definitely verify. That was a question that just came in through the chat, is what about traveling nationally and internationally with kids? That's one of those things where it really depends. It depends on how old the child is. It depends on whether they've been vaccinated. It depends on what the risks versus the benefits of travel are. I would certainly look into whether wherever you're traveling has requirements for getting tested. Some countries do require you to get tested before leaving the United States, before entering their own countries, or quarantining afterwards. And so I would look into the requirements of wherever you're traveling to. But in terms of the risks of traveling with kids, if your kids are unvaccinated, I personally would act just like I would prior to getting vaccinated myself, just taking precautions, making sure I'm wearing a mask, trying to keep my distance. And I don't intend on traveling. I have 2 children, they're 4 and 5 years old. I don't plan on traveling with them by plane until they're vaccinated. That's just me. But I would also encourage folks to talk with their child's provider, their healthcare provider, their doctor, if they have specific questions for their situation, because every situation is a little bit different. All right, so the more we can get people vaccinated, the more and more of us can do these kinds of things. So let's talk about that. Let's talk about how we can help reassure folks, how we can help build that confidence to getting vaccinated. And there are some things to keep in mind. Getting vaccinated is a choice, and a lot goes into making that choice. We are complicated people. We have thoughts, we have experiences, we have friends and family that influence what we think and how we feel about things all the time. It's not just about vaccines, it's about a lot of other things too. And so, it's important to keep in mind that the things we read, the stories we hear, how we felt about the pandemic, how we felt about the precautions we've had to take, all of that can affect whether or not we decide to get vaccinated or not. So one thing to think about is, whether getting vaccinated is something that will personally benefit another person, and only that person can answer that question. So I just want to make sure that we acknowledge that getting vaccinated is a personal choice. It's not our choice to make. We can make it for ourselves, but we can't make it for our patients. Our job as community health workers is to help ensure that when people do decide whether to get vaccinated, that they aren't deciding based on inaccurate information or unaddressed fears. We want them to have the science-based answers that they need to make an informed choice. And hopefully, ultimately, they decide to get vaccinated, but that is their choice. And it is one that doesn't just affect them, but it is one that as individuals, we all make for ourselves. So how do we do that? How do we help folks make an informed choice and build confidence? There are 3 things that I really want to hammer home today. These are what research shows are very, very important when it comes to improving vaccine confidence. And the most critical is trust. People are more likely to believe information if it's coming from someone they trust. The messenger is just as important, if not more so, than the message itself. So as community health workers, you have the trust of your communities, and that's amazing. People who might not trust health officials or government agencies like the CDC, they trust you. So what you say might have a lot more weight than anything they'd hear on the news or on social media. The next is transparency. To have trust, we have to be trustworthy. And that means being open and honest about what we know, what we're still learning, and where we get our information, so that they can know that they can continue to have trust in us. And then also compassion. Remember, as I said, there's a lot that goes into making a vaccine decision. It's okay to have questions. It's completely understandable that some are worried or afraid. Some might have had bad experiences or a trauma that make it really hard for them to make this choice. Others might have been exposed to a lot of misinformation that affects how they think about things or how they feel about things. Many of you might already be aware, but there are people whose job, whose living they make by pushing out misinformation about vaccines. That's how they make their livelihood. So they push out messages that can look innocent, but are actually designed to make people feel afraid and angry or threatened. And when we feel those strong emotions, we don't always think clearly or critically about the information we're seeing. And that can lead some to feel like they're constantly under threat, or they can feel overwhelmed by the information. So people need to know that you get that you understand, that you're on their side, and that you know that they are just trying to do what they think is the right thing for themselves or their families. And just remember, if people feel heard, they'll be much more likely to be open to listening. So as you can imagine, there is no universal one-size-fits-all approach to building confidence. I'll walk you through a particular strategy that you can use to guide conversations, but that strategy will need to be adapted for each person and each situation. How I talk about vaccines with my grandparents isn't going to be the same as how I talk about them with my teenage niece. Sometimes I need to recognize too that I'm actually probably not the best person to answer someone's question or address their concern. There might be somebody who has more trust with that person or a better relationship that might be a better fit for that conversation. And then just recognize that everybody is different. So the way we respond, really needs to be tailored to that person so that it resonates with them and their specific concerns. Kendra has asked, can you elaborate or give the example of whose job it is to push misinformation? Sure. So I'm based here in Houston, Texas. And here in Texas, we actually have a very lively anti-vaccine activism community. And there are individuals whose job is to speak to anti-vaccine activist groups. So they travel the country and they speak at rallies. They get paid to speak at rallies. They have they get donations through social media and have people send them donations so that they can post videos and put out messages about vaccines that are actually not true. Some of these individuals, I'm sure, fervently believe what they're putting out. I don't know their motivations, but they do make a living off of putting out inaccurate, misleading information about vaccines, specifically to discourage people from getting them. And so I'm happy to talk more about you with that if you'd like. I'm happy to share my email address if you're interested in learning more about that. But yeah, it's unfortunately true that there are folks out there who make quite a lot of money to do that, to put out that misinformation. All right, so in addition to adapting the message, we also want to make sure that we're using a mix of storytelling and statistics. So, some people might, really respond well to statistics. They might, hear 1 in 1,000 and that resonates with them. They might, for example, when I shared with you about side effects, and I shared with you, that the vast majority of people only experience mild or temporary side effects. That might have resonated with some of you. Others might have found it much more helpful when I shared what happened to me after I got vaccinated. We all respond differently to different kinds of information. So when we're talking to somebody new, perhaps, or somebody we don't know quite well, just make sure that you use a mix of storytelling and statistics to make sure that you give information that will resonate with whoever it is you're talking to, because again, we all respond differently to stories or statistics. And then when we talk about vaccines and respond to questions, we might not be able to, respond to all concerns, all questions in one conversation. We might need to leave the door open and have multiple conversations with people before they start to feel more comfortable. And today I'm going to show you some examples of how to respond to common questions. I'll give you a framework that you can use, and then I will show you kind of using that framework how to respond to a given question or concern. But these are not meant to be scripts. I hope you all will take them as simply a guide, and then you use them, you adapt them, tweak them to however you need to for when you are talking to patients and clients. I kept them simple because it's a little hard to show a back and forth or multiple conversations in this webinar format. But in real life, you probably will need to have, a longer conversation than what I depict here, or you might need to talk with somebody multiple times. Another thing to keep in mind is that, we know that vaccination is the safest choice for most people. We know based on the science that the benefits far outweigh the risks. But again, it's not our decision to make, it's theirs. So if after responding to their questions, the person you're talking to still feels unsure, we have to respect that. And what we can do is we can let them know that we care about them, and that if they have more questions or want to talk about it again in the future, we're here. We're here for them. We want to keep that door open for a continued conversation. All right, and that's really how we increase vaccine confidence as CHWs, through our relationships, one conversation at a time. But I know that these conversations aren't always easy to navigate. People can feel really strongly about vaccines, and sometimes that can make things get a little heated. So I've found it helpful to have a framework to help me walk through these conversations. And one method that's really great for this is the case approach. This approach is really great for when you work one-on-one with somebody. I wouldn't use necessarily the case approach when I'm talking to somebody on social media. I think that's a kind of different skill set. But when you're talking with one-on-one, I found this framework to be really helpful. And this approach was developed by Allison Singer at the Autism Science Foundation. And I've been teaching it for several years now. And I know many healthcare providers who found it really helpful to talk about vaccines with those who might have questions or concerns. It might not be effective to help walk through the conversation for somebody who is adamantly 100% against all vaccines. That's not really what this approach is for. This approach is to help those who, they're not adamantly against vaccines. They just have questions or concerns. And this framework can help with that. But before I dive in and talk about what each of those letters, what CASE means, I do want to encourage you all that before you launch into a discussion, that you really listen. So if you're talking with someone and they say, no, I'm not going to get vaccinated, or no, I won't get the vaccine, or I don't think I will, we shouldn't assume we know why. We shouldn't assume that we know their motivations or their reasons. So one thing we can do is we can say, would you mind telling me more about that? What's worrying you? Because we can't address their specific concern if we don't know what it is, right? All right, so then once we know their concern though, one thing we can do is we can start with C, which stands for corroborate or find common ground. So if someone tells us their concern and we jump right in to tell them that they shouldn't be worried about it, or that, oh, that's not true, it can really make them feel defensive or embarrassed. And the conversation is over before it really starts. So we want to start from a place of compassion and let them know that we're on the same side. We all want the same thing. We all want them to be healthy. And so starting it from that place of together, we're going to figure this out together, can really set the tone for a respectful conversation. Then you want to lay out what you've done to educate yourself about their specific concern. right? You don't have to strut. You can keep it simple, but you want to be transparent and let them know that you aren't just pulling this out of nowhere. You've done your research, and this is where you found the information you're about to share. And only then, after you've met them where they are and you've been transparent about your own education, only then do you talk about the science. And SCHWs, you already know how to do this really well. You know how to share information in a way that resonates and is understood by the person you're talking to. You use plain language. You keep in mind health literacy and cultural competency. This is your jam. This is what you all do really, really well. And so this is where you can shine. And then something to note, though, I do want to point out is that one thing we want to make sure while we're talking about vaccines in particular is that we want to be very honest. We want to, vaccines are one of the most important tools that we have in this pandemic, but they aren't 100% perfect and they aren't 100% safe. Nothing is, not even fire extinguishers or seatbelts are 100% safe or work 100% of the time. So we don't want to exaggerate the benefits of vaccines. Vaccines are great, but we don't need to exaggerate the benefits. And we definitely don't want to minimize the risks, right? So that goes back to the being transparent, being trustworthy. So we want to be open about, what the true benefits are, what the risks are, what we know, and what we're still learning. And then based on the science, explain the recommendation. So as community health workers, we don't diagnose, we don't treat, we don't prescribe. That's not our job. But we can share our own experience and what we hope they'll consider doing based on the science that you just shared. And if you can here, try to stick to more positive emotions. Shaming people or trying to make them feel guilty can really backfire when it comes to vaccines. That's what the research shows. So we want to really stick to what are the positive aspects of this recommendation. And I can show you, when I go through the approach, I will show you some examples of how you can do that. So let's look at some questions people had about COVID vaccines. And we're going to talk a little bit about the questions, but we'll also talk about the science, the processes, and then how you might respond to someone saying something like this using the case approach that we just talked about, as well as some of the other research-aligned techniques, like showing compassion, using a mix of storytelling and statistics, and those strategies. So a quick note for those of you who speak Spanish, some of these upcoming slides are only in English, but we do have them translated into Spanish, and we'll send them out as a handout after the webinar is over. So you will get to see these responses in Spanish. And all these concerns that we're going to go through in these next several slides, all of these concerns are things that community health workers, promotores, outreach workers shared as concerns, questions that they've been hearing from patients and clients in the agricultural community. So hopefully we'll cover some of the things that you all have been hearing on the ground. And if we don't cover everything that you all have been hearing, I will share with you some resources on where you can find the answers to some other additional questions that we might not cover here. So the first concern that I want to look at is the vaccine was developed recently. How can we trust it? Right? I'm sure some of you have probably heard this. I know I've heard this several times from folks in my life. And before I jump into the response, I do want to talk a little bit about the science, talk a little bit about the process. So I'll start with this question that I'll pose to you all. What do you think has to meet a higher standard for safety in the United States? Vaccines or vitamins? So if y'all would go to the chat, let me know what you think. What has to meet a higher standard for safety? Vaccines or vitamins? Yeah, y'all are a very smart group. The answer is vaccines. Vaccines have to meet a much higher standard for safety than vitamins before they can be used in the US. It's not even a contest. Vaccines have to go through safety testing and be constantly monitored for safety issues in order to be used here in the United States. Vitamins and other nutritional supplements don't. So things like vitamins, herbs, minerals, and essential oils, things like that, they're not regulated like medicines and vaccines are in the US. Companies don't need to prove that these products are safe or work in order to be sold in the United States. Vaccines, on the other hand, have to go through a ton of safety testing before they can be sold. And then I'll talk a little bit about what happens after they start getting used. So this is true for all vaccines in the United States, and this is true even for COVID vaccines. So they all need to be tested through multiple stages of clinical trials. These are studies that are done in people. And the first phase starts out small, and then each stage gets a little bit bigger. So the phase 1 trials might have, about 100 people in it. Phase 2 will have hundreds. Phase 3 tends to have thousands, if not tens of thousands of people. And the reason we do these studies at all is because we want to answer two primary questions. The first one, and the most important, is the vaccine safe? This is how these trials are how we can answer that question. Is the vaccine safe? What are the side effects? Are people having, bad reactions to it? What is happening to folks after they get the vaccine? And then the second question that's answered is, does the vaccine work like it should? Is it protecting people? Are their bodies responding to it positively? And those are the things that we can answer with these clinical trials. And sometimes these phases are done, we do phase 1, we stop, we do phase 2, we stop, we do phase 3. Sometimes though they're done, we might do a phase 1 and phase 2 combined trial. Sometimes we might do a phase 2 and a phase 3 trial combined. That's actually not uncommon. And some of the COVID vaccines did have, collapsed or condensed, where we had phase 2, phase 3, or phase 1 and phase 2 kind of done at the same time. But the same information is collected regardless. And the only way that vaccines can be used in the United States is if they go through these phases, and these phases show that yes, the vaccine is safe, and yes, the vaccines work. All 3 COVID vaccines that we use went through these phases. The manufacturers are still following participants in the phase 3 trials just to make sure that there aren't any long-term side effects, which I'll actually talk about in a bit. But every single one had to go through these phases and follow vaccine recipients for at least 2 months before the vaccine could be used by the general public. And normally it takes years to get vaccines through testing, through authorization by the government, and then shipped out to clinics and pharmacies. That normally takes years. We were able to get the COVID vaccines, in less than a year. And I know that was really quick, but it wasn't because we skipped safety testing. Again, all COVID vaccines went through safety testing. They went through clinical trials before they could be used. The reason that we were able to get a vaccine so quickly was because a lot of people and money, to be honest, came together to make it easier for the vaccine to navigate through that process. And I'll give you some examples. So let's start with research. To make a vaccine, you need science, you need to have a good foundation for research. And researchers, the COVID virus, SARS-CoV-2, might be new to humans, but coronaviruses aren't. And even though some of the vaccine technologies that we used, like mRNA vaccines, this might be the first, the COVID vaccines might be the first mRNA vaccines authorized for widespread use in the United States, but they weren't the first mRNA vaccines ever made. Researchers have been testing, or they've been studying mRNA for about 60 years. They've been testing mRNA vaccines for a variety of conditions and diseases for years now. So we already had good data on how to make them and how safe they were in people. And then likewise, scientists have been studying other coronaviruses. So this is the COVID virus is one coronavirus, but it's very similar to some of the other coronaviruses out there. scientists had been studying and trying to make vaccines for years against those coronaviruses. So researchers had a really good head start on how to go about making a vaccine. That saved them some time. They also had plenty of funding. So usually scientists have to apply for grants and wait for government or wait for a government or company to, give them enough funding to get their vaccine through to the next testing phase. And that wasn't an issue with the COVID vaccine. Governments and companies, they decided that money wouldn't be a reason why a COVID vaccine candidate couldn't move forward. So that hurdle was removed. Next, people were really eager to participate. To test vaccines, you need people. You need people to volunteer to participate in the clinical trials. And it can take a while to get enough people to sign on to do the study. But for the COVID vaccines, tens of thousands of people raised their hands and said, I'll join, let me help. And so that helped save researchers a ton of time. Then, in order to test whether the vaccine works, you need people to get sick, right, with the disease so that you can see whether there are fewer cases of the disease in the vaccinated group compared to those who didn't get the vaccine. And vaccine scientists will often have to wait for an outbreak. They have to wait for enough disease to compare those groups. But COVID was everywhere. So researchers were really able to get the data, get the information that they needed much faster than normal. They also had a jump start on making and shipping out large amounts of vaccine. So usually vaccine makers don't start making big batches of vaccines until the vaccine has already been authorized, because if it ends up not being authorized, then all that money goes to waste. They can't sell the vaccine. They lose all of that money. But for COVID vaccines, they decided that it was worth the risk. They would rather spend a lot of money to create large batches of vaccine ahead of time so that the vaccine was ready to go as soon as it was authorized. They could start getting the vaccine in arms. They decided that they wanted to make sure that they could do that, even if it meant having to throw out large amounts of vaccine if the vaccine didn't end up working. Thankfully, we didn't have that happen, but that was one way that we were able to save a ton of time. And so something that normally happens after authorization, we were able to do it before and save months, if not years of time. One more thing that was done was that the vaccine was authorized under what's called an emergency use authorization. So to get the usual approval, vaccine scientists usually need to follow study participants for about 6 months after getting vaccinated, just to make sure that there aren't any long-term side effects. But we didn't really have 6 months to lose. COVID was killing so many people, thousands a day. So federal regulators said that the vaccines could be authorized for emergency use, but only if researchers followed participants for at least 2 months. And that was really important because given what we know about vaccines and all the other vaccines that we've had, we know that side effects almost always show up within a few days, weeks of getting vaccinated. I'll talk about this in a little bit, but that 2-month window was actually a very solid amount of time based on what we know about vaccines in general to find out whether there was any safety concerns for this vaccine. And really all of those, yes, I'm so sorry. I will slow down. Thank you, Zeke. So really all of those factors came together to help clear away hurdles that normally slow down vaccine researchers and manufacturers. And it's how we were able to get a vaccine authorized so incredibly quickly. It wasn't because we skipped safety testing. It wasn't because we cut corners on safety. It was because we kind of cleared away those things that normally slow vaccine makers down. And safety testing didn't stop just because the vaccine started getting used. In the United States, we have multiple systems set up to watch out for side effects, especially those that are too rare to see in clinical trials. So, if a side effect happens once every 100,000 or 200,000 people, you really might, it's really uncommon to be able to see that in a clinical trial with 30 to 40,000 people in it. It's just too rare to see during those studies, as good as those studies are. And so on top of, I won't get into detail about all three of these systems, or about all four of these systems. Three of them we use for all vaccines in the United States. The fourth was added specifically for COVID vaccines. It's called vSafe. And if you've been vaccinated against COVID-19 in the United States, you've probably already participated in vSafe, or you were invited to. Essentially, you get a text message reminding you to let health experts know, to let the system know if you've had any side effects after the vaccine. So I've been doing that. I've been letting them know. I let them know about my headache. I let them know about my sore arm. And this is a really important system because it gives very quick information to health experts to help them spot any side effects that they might not have seen in clinical trials. And that actually was really important for the Johnson & Johnson vaccine, which I'll talk about in a bit. This system worked. It is very, very good at finding those rare side effects that we might not have seen in the clinical studies. And if at any point these systems find that a vaccine's risks are greater than the benefit, then health experts recommend a pause of the vaccine. All signs so far with the COVID vaccines, with the clinical trials, with the safety monitoring systems that we have, all of those signs point to the benefits of the COVID vaccines very clearly outweighing the risks. And as I'll talk about, even that is true even with the Johnson & Johnson vaccine. And I'll explain why when we get to that portion of the webinar. So I know that was a lot of info, but it's important to keep in mind when you come across someone who is worried about how new the vaccines are or how quickly they were developed, because it didn't come from nowhere. There was a ton of work, a ton of people that really came together all across the world to make this vaccine happen as quickly as it did. So if you do hear that, here's an example of how you might respond using the case approach. So starting again with corroborate, you could say, COVID vaccines were made really quickly compared to other vaccines. That's true. And I was worried about that at first too. But then I read about what all had to happen in order for the COVID vaccines to become available in the US. And I learned that COVID vaccines had to go through the same safety testing that other vaccines go through. They were tested in tens of thousands of people. And now that they're being used, multiple systems are set up to make sure the vaccines keep being safe. Millions of people have been vaccinated over the past few months, and all signs point to the benefits of the vaccine far outweighing the risks. And here's also another opportunity that if you want to share, if you've been vaccinated, you can share what you experienced after the vaccine. So learning all that, learning what all had to happen for a vaccine to be used, that really calmed my mind. Given what we know about how serious COVID-19 can be, I'm really excited that we were able to get a vaccine as quickly as possible without sacrificing safety. I've gotten the vaccine. I really hope you do too. So again, for Spanish language participants, we will have handouts with the exact same thing that I just said available for you after the webinar. All right, so a similar concern that some folks have is about long-term side effects. Because the vaccine is so new, they're worried that there might be side effects that we don't know about yet, or that could crop up months or years later. And that's completely understandable. It's also really unlikely, given what we know about other vaccines. When side effects happen, they nearly always appear within a few days or weeks, as I mentioned. Even when there's been a delayed reaction after a vaccine. So looking at the history of vaccines, we've had vaccines for about 200 years. In all the history of vaccines, when we've seen a delayed reaction, those reactions were spotted within 2 months of getting vaccinated. And we already had 2 months of safety data on every COVID vaccine when it was authorized. And now that they've been out for several months and have been given to millions of people, we have a pretty good idea of what side effects to expect and when. We can't say with 100% certainty that there won't be long-term side effects, but we can say very confidently that it's very unlikely that there are any. So here's how you might respond to someone with that concern using the case approach. COVID vaccines are new, so I understand the desire to want to wait and see what happens to other people. I read a really great article by a vaccinologist on the Children's Hospital of Philadelphia website. And in it, he said that while researchers are still doing studies to confirm, it's highly unlikely that there will be any long-term or delayed side effects to these vaccines. In the 200 years we've been using vaccines, only a few have any delayed or long-term side effects. And all of those were spotted within 8 weeks of the vaccine. What's more, COVID vaccines might be new, but the technologies used to make the vaccines have been studied for years to prevent other diseases. And there haven't been any warning signs that there are long-term side effects with those vaccines either. I was really reassured by that, especially given how much we know about the long-term effects of COVID. All right, so let's talk about J&J, Johnson & Johnson. So is it true that the Johnson & Johnson vaccine causes blood clots? This is a really great question. And before I show you a sample response, let's talk a little bit about what happened. So last month, health officials called for a pause of the Johnson & Johnson COVID vaccine, the one-dose vaccine, after they found 6 cases of a rare type of blood clot combined with low blood platelets, a condition called thrombosis with thrombocytopenia syndrome, or TTS. This is a pretty serious combination because it requires a different kind of treatment than other kinds of blood clots. The usual way that we treat blood clots could actually be very dangerous for people who have this condition. So that's why it raised such an alarm. All of the cases were in young women under 50. And so this was enough to cause a pause. 6 cases out of about 7 million doses of vaccine. So it was really, really rare, but because it was so serious, health experts wanted to pause so they could get more information about what was going on. They wanted to find out, are there more cases? Are we missing some other aspect of this? What might be leading to this? Are there certain things that increase somebody's risk of having this condition? They wanted to answer all of those questions. They also wanted time to alert healthcare providers, to alert doctors and clinics about what this condition was, because it was so rare and because treatment was different. Lydia's asked, I heard that there were 4 deaths. Is that false? There have been some deaths from this. I know that there have been at least 3 deaths, but I will need to check on what the latest number is. So far, health investigators have done a lot of investigating about this particular condition, and they've tried to find as many cases as possible to make sure they didn't miss any. They found 17 cases of TTS. So they started with 6 and they were able to find 11 more. And this is again out of about 8 million doses of the vaccine. So they were able to confirm that this condition is thankfully very, very rare. The next thing they wanted to do was consider that question, do the benefits still outweigh the risk? Given what we know about how serious this risk can be, how often it happens, do the benefits still outweigh the risks? And the answer that they came to was yes. Getting sick with COVID is still a much, much bigger risk, even for healthy young adults. So health experts actually did a lot to help answer this question. And one of the things that they did was they ran some numbers, they did some modeling to find out, given what we know, how many cases of TTS, the rare blood clots with low platelets, how many cases would we expect for every 1 million doses of the vaccine versus how many COVID deaths and COVID hospitalizations we could prevent with the vaccine. And even when we look at the group most at risk for this particular condition, so that's women ages 18 to 49, even when we look at just that age group, the benefits very clearly outweigh the risk. The vaccine would lead to an estimated 7 cases of TTS, but it would prevent 6 deaths and nearly 300 hospitalizations. So the numbers were even more clear when they looked at other groups like women over 50 and adult men of any age. And this is really what led health experts to lift the pause and start vaccinating again, is because they were very worried about how many people might die if they don't have access to this vaccine. One of the benefits of the Johnson & Johnson vaccine is that it is 1 dose and that you don't need really, really cold freezers to store it. So this vaccine was was being used in populations that otherwise might not have been able to access a COVID vaccine. So places that might not have cold storage for the Pfizer and Moderna vaccines, they wouldn't be able to store those, or for groups that would be really difficult to get back in for a second dose. This 1 dose vaccine, it really had some very unique benefits. So they had to take that all into consideration. This was a very serious risk and they took it very seriously. But the reason why they lifted the pause is because they found that more people would get hurt by not using the vaccine than people would get hurt by using it. And Paul Castillo is asking, how deadly is TTS? We're still figuring that out. It's hard to say because the earliest cases, again, this particular condition it's not often seen together. You don't often see blood clots with low platelets. That's a really rare combination. And so doctors didn't necessarily know what to look for, and so they didn't also know necessarily how to treat it effectively. So now that doctors have more information about how to treat this particular condition and they know what to watch out for, then we probably will have a better understanding of how deadly it is. We do know, however, that with early treatment, that it is very treatable. We do have treatment for TTS, especially if we're able to get people in to medical care very early. And that's actually what I'll talk about right now. So if you get the J&J vaccine, or if you've already received it, it's really important to reassure people that the risk is very small. Again, this is a serious risk, but it's also very, very uncommon. We've had 17 cases out of nearly 8 million doses. So the risk is still very small. The overwhelming majority of people who get the Johnson & Johnson vaccine will be totally fine. They won't experience this particular condition. Even so, we want to encourage people to watch out for signs for at least 3 weeks after getting the vaccine. All the cases that we've seen so far have happened within 3 weeks of getting the vaccine. So the signs are severe headache. That's really important, especially for if you start to experience the severe headache like a week after getting the vaccine. A regular headache immediately after getting the vaccine or the day or 2 after a vaccine, that's actually really common. Headache is a very common side effect of the vaccine in general. It doesn't mean that you have a blood clot, but if you have a severe headache, especially one that's the one that shows up 5 or 6 days after the vaccine, that's when it first appears, that could be a sign that you really need to get medical care. Other signs include backache, any new neurological symptoms like blurred vision, for example, severe and persistent, so it won't go away. abdominal pain, leg pain or swelling, tiny red spots on the skin, new or easy bruising, or shortness of breath. If anybody has those signs within 3 weeks of getting the vaccine, we want to make sure that they get in to see a doctor as soon as possible. And thank you, Carrie. Yes, so Carrie asked if there were any effect modifiers that might be considered so they could provide guidance on who should not get J&J and if they can get other vaccines instead. Those decisions should be discussed kind of on a case-by-case basis. So they do think that it's important for people to talk to their doctor or talk to a medical provider if they're worried about this particular risk. Thankfully, there are 2 other vaccines that they can receive. We have not seen TTS. We have not seen TTS in folks with the mRNA vaccines. So the vaccines that made by Pfizer and Moderna, those vaccines do not seem to have the same risk. So if you are worried about the J&J vaccine, you can always, this risk with the J&J vaccine, if you have the ability to get the other ones, that is also an option. So there was a question about the numbers that I included on the slide. This slide right here, for every 1 million doses of J&J vaccine, we would expect 7 cases of TTS. This comes from a presentation that was presented to the group that makes vaccine recommendations in the United States. It's called the Advisory Committee on Immunization Practices. I'm happy to share a link to that slide deck if anybody would like to see it. This particular risk is just for what we would expect to see just in women ages 18 to 49, but I'm happy to share that source with you all. All right, so how would we talk about this? Start with corroborate. So if somebody tells you, is it true that the Johnson & Johnson vaccine causes blood clots? We can say, there has been a lot in the news about that. Some people had a rare but serious type of blood clot combined with low blood platelets after getting the Johnson & Johnson vaccine. That's true. I was recently in a training that talked about what happened and what's going on. Investigators are looking into it. It's serious, but also extremely rare. When health experts ran the numbers, they found that even with the rare chance of this condition, you're still more likely to be hospitalized or die if you get COVID. That said, if you're still not comfortable, you could always try to get a different COVID vaccine like the ones from Pfizer or Moderna. This issue hasn't been seen in people who got those vaccines. The Call for Health line could help you find out which sites carry those vaccines. Would you like me to call with you? And Zeke has asked me to hold this slide, so I will for a brief moment. And we will talk about the Call for Health line in a little while. So another question that somebody might have is about fertility. So let's talk about fertility and the COVID vaccines. And I'll actually say this is a really good example of some beliefs that are being pushed very strongly by anti-vaccine activists on social media in particular. This is not the first time that anti-vaccine activists have tried to push the idea that a vaccine would make somebody infertile. We actually saw this happen with HPV. We've seen it with the hepatitis B vaccines. It wasn't true with those vaccines, and it doesn't appear to be true with the COVID vaccines. This myth was actually started by a blog post with the idea being that somebody thought that because the protein, the COVID vaccines work by making a particular kind of protein. It's the spike protein that is around that virus. So if you've ever seen the pictures of the coronavirus, you'll notice they have those little spikes all the way around it. The COVID vaccines work by really helping our bodies identify those spikes. So those spikes are similar to spike proteins, or sorry, to proteins that are on the placenta that are made during pregnancy. And so the idea that was pushed out by this blog was that the body wouldn't be able to tell the difference. And so by teaching our body to fight the spike protein on the coronavirus, that we would inadvertently attack the placenta proteins, and that would lead to infertility. But our bodies are a lot smarter than that. Our bodies can tell the difference. They don't inadvertently attack the placental proteins. So this is a myth. It is not true, and it's not based on any kind of research. We do know that there were people who got pregnant during the clinical trials. There are people who were vaccinated during pregnancy and have had very healthy babies, some of whom actually had antibodies. So they showed signs that they had some protection against the virus. And so, we're still researching this question. We're still making sure that the vaccines are safe during pregnancy, that they don't affect fertility, that they're safe for women for those who are breastfeeding. But all research so far shows that there doesn't appear to be any link with infertility, and that these vaccines are safe and effective for those who are pregnant and those who are breastfeeding. Yeah, and Carrie has a great comment. She said that her partner actually designs proteins, and one thing that can be said is that proteins are very specific binders. They're like puzzle pieces. They may look like they fit, but they don't. And that's a very good way to put it. Thank you. All right, so how might you respond to this particular concern? I'm scared it will make me infertile. You can say, I've seen a lot of posts about that on social media, and I can understand why you're concerned. I was too. So I tried to find everything I could about how the COVID vaccines work and what the research has shown so far. And there isn't any evidence that any vaccines, affect fertility. The reason some people think that is because the spike proteins around the virus are similar in some ways to proteins on the placenta where a baby develops during pregnancy. So they're worried that if our bodies learn to attack the COVID virus, then it will attack those placental proteins and lead to infertility. But our bodies are smarter than that and can tell the difference. Many people have gotten vaccinated during pregnancy and have gone on to have healthy babies. And if you actually know of somebody who received the vaccine, who got the vaccine when they were pregnant and now have a healthy baby, and you feel comfortable sharing that story, that might be a good way to incorporate a little bit of storytelling into your response. Some people put out these messages because they want to scare others away from getting vaccinated, but all the research so far continues to show that the vaccines don't affect fertility. What they can do is protect you from COVID. I'll leave that up for a minute for Zeke. We're running a little low on time, so I'm not going to be able to get through all of these slides. So I will let you all know that I do have responses to many of these concerns that we will send out as handouts. So you'll still be able to see some of these responses, even if we're not able to discuss them on the webinar itself. So I'm just going to go through a couple more, but I want to make sure we have time to talk about Call for Health and to share some of the resources that you all can use and look to for science-based answers to questions that you might encounter with your patients or clients in the agricultural community. So how can we determine which vaccine to choose? That's a really important question, and it's a hard question to give a straight answer to. So I'll give you an example of how I might respond to this particular question. It's great that you want to get vaccinated. We want to really establish that we're on their side, and it's awesome. They want to get vaccinated and they want to find out which vaccine to choose, acknowledge that it's a really great thing that they chose to get vaccinated. When I was trying to figure out how to get vaccinated, I looked into how effective the vaccines were at protecting people, especially from serious illness like getting hospitalized or dying from COVID. And I found out that while there are pros and cons to each of them, all three of the vaccines are safe and really good at protecting people from getting seriously sick or dying from COVID. That was the most important thing to me. So then the next question I asked myself was, where can I get vaccinated the soonest? And that's how I chose which vaccine to get. The site that could vaccinate me the soonest only had Moderna, so that's what I got. What's the most important thing to you? Because ultimately, determining which vaccine to choose will be based on what's most important to you. If you have some concerns about, the Pfizer or Moderna vaccines, then the Johnson & Johnson vaccine might be a good choice. If you are in an area with very limited access, or you're not able to get an appointment where you want to get a particular vaccine, that can make the conversation a little trickier, right? And it really comes down to, how do you connect people to care? The Call for Health app, we'll talk about in a bit, can be a great option. There's also a site called vaccinefinder.org where you can actually select which vaccine you're looking for appointments, and it'll show you where those vaccines are available near you, near your zip code. Another question, how are we going to protect ourselves against the new variants of COVID? And this is a fantastic question because we see a lot about these variants in the media, right? On the news and on social media, we see phrases like double mutant, and those can be very scary. So how are we going to protect ourselves against the new variants? Well, we can respond by, acknowledging that it's a really good question to ask. The good news is that I've heard from scientists and health experts that there's a pretty straightforward answer to this question. The more people who get COVID, the more opportunity the virus has to change. So the best way to protect ourselves from these variants is by preventing COVID altogether in as many people as possible. That means getting vaccinated and continuing to take precautions like wearing masks when you're around other people and avoiding crowds. The variants can be tricky, but research so far shows the vaccines do help protect us against getting seriously sick or dying from them. Have you thought about where and how to get vaccinated? Would you like my help scheduling an appointment? We have some questions coming in, and so I just want to take note that I am seeing them, and I will try to answer them as soon as I can. One that I really want to make sure I cover is, does the intensity of one's reaction to the vaccine have any correlation to the level of immunity provided? So basically, if you have a super strong reaction to the vaccine, does that mean that you're making a lot of antibodies that you'll be even more protected? There's not a simple answer to that question. I do know that if you don't have a reaction, if you get the COVID vaccine and you don't get a sore arm, you don't get a fever, it doesn't mean that you didn't build protection. Remember, every body is different. Every person might respond differently to a vaccine, right? So to answer that question, you really need to look at studies looking at immunogenicity and reactogenicity. And I don't have those at my fingertips, but if you email me, I will be happy to see what I can find about that particular question. But if you don't have a strong reaction to the vaccine, don't worry. It doesn't mean it didn't work. All bodies are different. And the question was, does the intensity of one's reaction to the vaccine have any correlation to the level of immunity provided? Zeke asked me to repeat that for the Spanish language audiences. And Carrie also asked, can you clarify for everyone what the term experimental means in terms of phased trials and drug trials? So experimental, that's a really hard thing to talk about, right? If you're not in the scientific community. So an experimental drug is something that is undergoing testing and that hasn't been authorized yet. It doesn't mean it's brand new. It just means that it is something that might not have been authorized just yet. And so they're having to test it before that authorization can happen. That we have to be careful with that word though, right? As community health workers, the word experiment can be interpreted in a lot of different ways in a lot of different cultures. So when we're talking about vaccines and how they're tested, we need to be careful, need to be careful about the words that we use, and also to really explain the whole of the process. So if somebody is concerned, and really the whole of the process as it relates to that specific concern. So if somebody is worried about, if they're worried about the word experimental because they're worried it's too new and it hasn't been tested, then that's where you can talk about the scientific process, the process that vaccines have to go through to show that they are safe and to show that they work. And I'm sorry, that was a long answer to that question. All right. And some people are asking about specific instances where, how long should people wait after getting antibody therapy or plasma treatment, et cetera. I will give you, on the resource slide, I can give you a look at where those considerations are outlined for healthcare providers. So you can see kind of what should be taken into account and what the recommendations are. And then there's a question about what is the latest study data indicating how long the vaccine will protect against COVID? That is to say, will we need boosters very soon? We don't know yet if we need boosters. There's research going on right now to find out if we do need a third dose of the Pfizer and Moderna vaccines or a second dose of Johnson & Johnson. What we do know, and that is largely to help protect against the variants that are slightly trickier, right? That the vaccine might not have full protection against, but definitely, again, the vaccines can help protect you from getting seriously sick, even with a variant. And we have some real world data from places like Israel that show that people who got the vaccine, even if they got the variant or a variant, that they were still more protected than the people who didn't. But we know from recent studies about Pfizer and Moderna that the vaccine protects for at least 6 months. We will continue doing those trials. We'll continue doing those studies to see how long the vaccine lasts and if we might need updates, if we might need booster shots in the future. All right, and we actually only have 3 minutes, so I promise that you will get some responses to these additional concerns in the handouts. But I want to make sure that we have time to talk about Call for Health because it's a really great program. And then really quickly, what to do when you don't know the answer. I do want to cover it. Just be honest. If you don't know the answer, be honest, but take into account cultural considerations because some communities might not respond well when you say, I don't know. But you could say, let me do more research on that, or let me confirm for you, and I'll let you know what I find. And then make sure that you follow up with that person and that you get them an answer if you promised an answer, so that you can continue to maintain that relationship and have that trust. Remember, these conversations happen one person at a time, and one conversation at a time sometimes. Some people have more than one concern, so please try to address each concern and be specific when you respond. Adapt your message again to the person you're talking to. The examples I gave were very general, so please try to put your own spin on it and take into account a person's cultural background, health literacy level, and what might be something that they value. Try to meet the message where they are. And then if things get heated, just let them know that you care about them and that you're there for them, and then you can don't push it. Just leave that door open for a healthy and productive conversation. So with that, I want to thank you all. I know we covered a lot of ground, and we had more ground we wanted to cover, but hopefully the handouts will help there. And I want to pause for a minute and ask Elvia to share a little bit about Call for Health, Una Voz para la Salud, which is a great tool that you all can have access to.
Thank you so much, Robin. So my name is Elvia Anderson, and I'm here just to briefly talk about Call for Health, what it is. And Call for Health, or Una Voz para la Salud, is a program, and it's a free service for agricultural workers and their families in the United States and in Puerto Rico. It's a national, toll-free, bilingual, in English and Spanish, health information and referral service program. Here at Call for Health, we help farm workers access healthcare services for adults and for children. And we also provide information about COVID vaccines, information about testing. We can also help them find a place to get the vaccine, especially in the communities of farm workers where they have to travel for work. Maybe they receive the vaccine, the first dose in one state, but they move to another state or another city or town. Here at Call for Health, we'll be able to find them a place where they can receive that second dose. Like I said, we're bilingual, so we do speak Spanish. Yo hablo español también. Entonces puede referir a todos los trabajadores agrícolas a nuestro número de teléfono. We also provide services or social services, referrals for farm workers. So we don't only provide health access information, but we also provide information for social determinants of health. So that's the phone number where Call for Health. You can reach us and Call for Help. It's 1-800-377-9968. Thank you.
Thank you, Elvia. And I just want to say thank you and gracias to Claudia Giselle Aparicio Gamundi, who made these beautiful illustrations that we used throughout the presentation. And if you have any questions, there are a few resources I want to highlight. The second cdc.gov link is the link for clinical considerations. But you can also Google CDC COVID vaccine clinical considerations, and it'll outline what those are. So if somebody received plasma therapy, for example, that would be where that answer is. Or if they received the AstraZeneca vaccine, if they only received one dose of a vaccine that wasn't authorized in the US, then what can they do? That is all there in that particular page. Thank you. And Erin sent the link, so it's available for you in the chat. And then the Children's Hospital of Philadelphia and Vaccinate Your Family, they have science-based answers to questions about COVID vaccines. Currently, they're only in English. However, the Vaccinate Your Family link will also very soon have Spanish language responses. And then the vaccinefinder.org can also help you find vaccines. So I'm sorry that we were a couple minutes over. Thank you all for taking the time. I hope that it was helpful. And if you do have any questions, please feel free to email me. I will go ahead and put my email in the chat so that you all can contact if you're interested.
Awesome. Thank you. Thank you so much, Robin. My hats go off to you. This was amazing. This information was so helpful. So thanks so much for sharing your knowledge with all of us. I do want to shout out real quick to the attendees before they drop off. Please be mindful of the chat. We're going to send an evaluation link just now in the chat box. These assessments always help us identify training opportunities and provide educational opportunities for the future. So please complete those before you go. Yeah, I see that Erin already put the evaluation in the chat. So just try to take the time to comment. If we miss some of your questions that came through the chat or through the Q&A, you can also share them on the evaluations. We'd love to create educational materials to some of the concerns that are coming through today's session. So please write them there if we didn't address some of the concerns today. And as always, if you registered for the training today, we will be emailing a list of resources like Robin mentioned. We'll also be sharing the slide deck and the recording to this presentation. Share it widely with your networks if they're also interested in this topic. Yeah, so if there's anything else that you may want to know that we didn't get to address today, just please put it in the evaluations. And thank you so much for attending today. We hope that you found value in this training and that you can take this information and share with the agriculture workers in your community. Thank you.